My name is Noraina, and I'm going to present about the knee strain. The knee strain are the common injury involving a torn muscles or tendon around the knee, and strain are often related to sports injuries. The patient may present stiffness or decreased movement, pain or tenderness, and swelling or bruising. There are a few risk factors, for example, playing sports, poor coordination, poor balance, muscle weakness, poor flexibility. And if the patient met the doctor, what the doctor will do, first, do physical examination, and the patient may investigate by X-ray, MRI, or arthroscopy, and the doctor may give management, like for example, RICE, anti-inflammatory drugs, brace or splint, and may refer to physiotherapy. If the condition is severe, the patient may receive surgery. Now, moving on to the prevalence of the knee injury. Strain and sprain are the most common knee injury diagnosed in the emergency department and composing about 42.1% of all injury regardless of cause. And researchers have reports that knee injury account for 15% to 50% of injury related to the athletes. Another study state that the body part injured the most common during games and practice are knee injury and also ankle. Now, moving on to the case study. My patient is 20 years old male and he was diagnosed as left knee strain in April 2020. He was received conservative management, which were painkiller and bandage. When the first time I met him, he was on his second visit. That was on 11 January 2021. His main complaint was he unable to bend down normally he also unable to perform salat normally as he unable to sit down for tayat awal and akhir, and he also complained feeling weakness of his left knee. I then asked about his home exercise program, and he said he only did squat at home for 10 times 3 sets in a day, and he also claimed he has a few progression from his first visit, which was on October. The progression are first, he able to going up and downstairs, he able to do cross-sitting, and he able to go jog, but he claimed having discomfort over his left tibialis anterior. Moving on to the past history, he injured his left knee while playing rugby in April 2020, but that was in rugby competition. He claimed he did not hear any pop sound because he was at the field and the field was quite noisy at that time. He was dragged out after he was injured and applied ice right after the injury. And he also went to doctors for that day, and the doctor did X-ray and was diagnosed left knee strain, and the doctor claimed there's no deformity was noted. The doctor gave medication and bandage. He was on bandage for a month, and he found out that he is having difficulties to bend his left knee, and due to that issue, he went to the clinic for doctor's consultation and was referred to the physiotherapy clinic in October 2020 for further management. Now let's dig into his social history. He is a student and also a rugby player at the same time. His main problem during his ADL is praying because he has to pray on the chair. He is also quite active before because he jogged every day, he went to the gym, and he also involved in rugby practice and also rugby competition. But now he unable to do all his hobbies because of injury. His main goal is return to the sports. Now let's moving on to the objective assessment. The first assessment I did on the patient is gait. I observed the gait and I observed that he has abnormal gait, which was the pelvic rotate to the left while swinging on the right leg, and also the trunk leans slightly to the left during swinging the right leg. Third analysis, while standing, there is no body weight shifting was noted, but the neck was slightly protruded, but that was very slightly. Pelvic was tilted posteriorly, and there is a flat foot for both sides, and no other deformity was noted. I asked the patient to do single leg stance in standing position, but patient unable to hold balance for both left and right legs, and the patient able to hold like less than 3 seconds for both sides. The next assessment in standing is squatting. During squatting, there is no deformity was noted at hip or knee area, but I unable to observe the feet as patient was wearing shoes at that time. Next, I asked patient to perform lunges, but patient unable to perform lunges at all. Next test is stepping up and down. While stepping up using the right leg, there is no abnormalities at all, but while performing using the left leg, there has a left lateral drop of hip and also lateral flex towards the left side of the body. And there is also a quick stepping down when anchoring using the left leg. Next assessment is in sitting position. There's two other tests that I did. First is alternate hip flexion and also alternate knee extension. While performing hip flexion, the pelvic was tilted posteriorly, and I can see the muscles of rotator spine is flickering while performing that action, and it shows that the patient has reduced control of rotator spine. And moving on to the next test, the patient able to straighten the both knees up to 0 degree, but the patient's body was slumped when performing that action. Next, moving on to the next test, which is bridging. First, I asked patient to do bridging with both legs on the planes. The patient able to maintain the spine in normal position, but patient complained of discomfort over rotator spine. And also, I challenged the patient to use only one leg while performing bridging, but patient unable to do either right or left leg, and he also unable to maintain the spine in neutral position. The next task is in prone lying position. While performing this position, I can see there is a different level of pelvic while in prone lying. Next, I ask the patient to do tasks for hip extension and also knee flexion. While performing knee flexion, on the right side, there is no deviation of tibia, but while performing on the left knee, there is a deviation of tibia to the lateral and reduced control in flexion and extension. I also palpating of the hamstring at the left side, and I can feel there is a stiffness compared to the right side. Next, I check for the range of motion of knee flexion. At the left side, patient able to perform actively from 0 to 130 degree, and the right side, patient able to perform from 0 to 35 degree. So there is just a 5 degree difference, and I did basically on the left side, patient able to exceed to 140. It shows that the patient has no problem with the bone. It could be because of the muscle structure only. While performing of the task for hip extension, there's no deformity on the right side, but patient complain of hyperactive rotator spine instead of hamstring and glutes while performing the left extension. This is what I did. I asked the patient to feel the contraction, which muscles are performing first, and he felt that rotator spine is working instead of hamstring and glutes. Now moving on to the analysis. After performing all the assessment, this is what I can see the problem of the patient while performing the action. The first problem I can see is the trunk is leaned slightly to the left side during swinging right leg. So this is the first task I did was kicked. The second is the left lateral drop and lateral flexion to the left side of the body while stepping up using the left leg. And also there is a quick stepping down with no control during stepping down the right leg. The third one is while anchoring using the left side. And fourth, unable to maintain neutral spines with one leg on the planes while bridging. And also there is a hyperactive of rotator spine instead of hamstring and glutes during left extension, left hip extension on prone. So all of this problem from 1 to 5, that one is because of the patient is having weakness of the glutes muscles. Next, moving on, the next analysis is first, the patient have the posterior pelvic tilt while hip flexion, and also the rotator spine was flickering and also unable to maintain spine in normal position, and also the complaint of rotator spine. It could be because of the patient is having poor core stability. Next task is the next analysis is slump body was noted while knee extension during sitting. So it could be because of overactive of hamstring, because the patient is having underactive of glutes, and also the patient complained of having pain at the rotator spine. So it means like the hamstring is working more than it should, as based on palpation also, there is a stiffness on the muscles over that. So that shows that the hamstring is hyperactive, and also the underactive of the erector spinae and also glutes. The next analysis is the deviation of the left tibia due to lateral during knee flexion while prone, maybe due to tightness of ITB, and also they have a poor balance of both leg during single leg stance, could be due to weakness and also reduced proprioception of the joint. So this is occur when the patient has already stopped sports for a long time. So this is not just only one-sided, but it's also occur to both sides, and also that towards his core also. So the treatment, I focus more on strength exercise and also proprioception only. So for strengthening exercise, for glutes, I ask the patient to do bridging, squatting, and kneeling to half kneeling. So I ask the patient to do 10 second, 10 repetition and also 3 sets. And so next is called strengthening exercise. I ask the patient to do lumbar stabilization in 4-point kneeling, and also I ask the patient to engage the core while performing other exercise. For example, while performing bridging, while performing squatting. So this is a combined exercise for doing other exercise at the same time. Next, moving on to the exercise for proprioception or balance, I ask the patient to step on using trampoline on the right side. So because the patient also have problem on the right side, so I ask the patient to do that movement, and the left side I ask the patient to step up on the stepper only. And last one, home exercise program. For exercise program is all as above, but I ask the patient to do plank, but I test first how many seconds that patient able to do. So the patient able to exceed up to 5 seconds, so I ask the patient to do 5 seconds only for 10 repetition. And after the test, I evaluate back, and I can see the deviation of the pelvic is a bit better compared to before the exercise. If you can see after the exercise, the pelvic is a bit reduced compared to before, because before the exercise they have the right side is a bit higher than the left side. So it seems that there has a bit improvement after the exercises. And also the evaluation for the knee flexion during sitting. So I ask the patient to do the movement during performing sola. So before the exercise, so the patient unable to sit like after the treatment. So you can see that they have a difference, because you can see that the patient look like more comfortable compared to before, and the range of motion of like you can see the range of motion from the knee flexion is higher before compared to after. So this is from the back view, so this is the side view. So you can see the patient able to cross his feet already after the exercises, and the back body is a bit relaxed compared to before, because before he's a bit slumped because due to stiffness of the knee. And the last, okay, that is all from me. Thank you.